let's talk about a common issue that many women suffer from: urinary incontinence. Patients often describe experiences such as, "Doctor, just as I'm about to pray, I feel the urge to pee. I go out, and before I can even walk an hour, I'm looking for a restroom. Even at night, it just trickles out. I'm changing my clothes 2 or 3 times a day, or I'm wearing adult diapers. So, what should we do?" Let's talk about it. Urinary incontinence is especially common in women who've had multiple births. It's even more likely in women who've gone through difficult or traumatic deliveries. Certain medical conditions can also make the problem worse. These include obesity and diabetes. Issues related to the spine, like herniated discs in the neck or lower back, can affect the nerves and contribute to incontinence as well. Nutritional problems, collagen deficiency, and early menopause are other factors that can increase the severity of symptoms. After the age of 40, many women start to experience light leakage when they laugh, sneeze, or lift something heavy. Women who could once hold their urine for 4 to 5 hours now can't go more than 1 to 2 hours. As doctors, we advise young women not to get into the habit of holding urine for long periods. Doing so can lead to urinary retention, disrupt bladder nerve function, increase the risk of frequent urinary tract infections, and, over time, potentially harm the kidneys. Drinking plenty of water is very important, but not all water is the same. Some types of water are low in minerals, so the body eliminates them quickly, and you find yourself rushing to the bathroom soon after drinking. Others, like Zamzam water, help you feel full and keep you hydrated longer, without triggering the urge to urinate right away. That's why water quality matters. We need to know the pH, additives, mineral content, and electrolytes in our drinking water. It's best to choose living water, clean, naturally sourced water, straight from the spring. Drinking high-quality water is the first step. You should make sure to empty your bladder at regular intervals and never wait more than 2 to 3 hours. If there's obesity, it needs to be corrected. Spinal issues like herniated discs can press on nerves and cause bladder problems. Many women live with these issues for years just to avoid surgery. I know this personally. I have a cervical disc hernia myself. We try to be patient. We don't want surgery, so we turn to physical therapy, alternative medicine, and holistic approaches. That's why it's important to identify what's causing the problem in the first place. When your doctor examines you, they might say that your bladder has descended, your vagina is severely prolapsed, your bowels have moved forward, there are birth tears, and you're experiencing incontinence due to frequent urinary tract infections. Or there might actually be no physical prolapse, but rather a collagen deficiency or weakness in the connective tissue. Perhaps you have diabetes. All of these need to be evaluated in detail. If the cause is found first, treatment becomes easier. So, what can be done for urinary incontinence? If there are complaints like vaginal dryness, burning, or narrowing of the urinary tract after menopause, bioidentical hormone therapy and PRP treatment for vaginal dryness can be applied first. Women should be supported with nourishing vaginal care products, suppositories, and creams, collagen supplements, consuming plenty of foods rich in collagen and probiotics, and physical activities like walking and swimming are recommended. An active lifestyle is very important. Going to bed early, waking up early, and being productive are highly valuable for women's health. If there's obesity, you absolutely need to get rid of it. If there's early menopause, we should try to delay it, if possible. If we're going to treat, we'll certainly try to maintain our women's well-being through counseling and examinations. Whatever the problem is, we'll focus on that. If surgery is needed, it will definitely be performed. If methods like bladder prolapse surgery, vaginal tightening surgery, or radiofrequency are needed, yes, radiofrequency applications can be done for 3 to 4 or even up to 5 sessions as needed. At specific intervals, the bladder neck will be tightened, vaginal tension will be increased, and vaginal cell regeneration will be promoted. If medication is required, some phytotherapeutic herbal drugs or chemical drugs will be provided, whichever is suitable for the patient. Of course, Kegel exercises, meaning exercises that strengthen the pelvic floor muscles, are very important. Sitting and standing movements, like Pilates and squats, targeting the pelvic floor, are particularly effective exercises for young women. You know how we say squeeze and release movements like you're trying to stop the flow of urine? These kinds of exercises help work the muscles in that area. Additionally, in women who experience regular orgasms, the pelvic floor muscles work during orgasm, which helps strengthen them. Therefore, a regular sexual life 2 to 3 times a week is very important for supporting both sexual pleasure and the health of the muscles in the pelvic region. Certainly, many factors increase our problem with urinary incontinence. These include conditions like our nutritional imbalances, lifestyle, less sunlight exposure compared to people in the past, and not being able to work in fields or gardens. Additionally, poor nutrition and a tendency towards obesity also impact this issue. Easy and natural births are also less common now than they used to be. Many deliveries are challenging, and this unfortunately often leads to urinary incontinence for women in later years. The most important step here is to get an examination first. Necessary tests will be performed, any existing problems will be identified, and appropriate treatment methods, such as surgery, phytotherapy, or radiofrequency, will be applied. Your physician will examine you thoroughly and guide you by determining the most suitable method for your specific needs. I wish all our women a speedy recovery and hope the days ahead bring a much more beautiful, healthy, and happy life. Goodbye.